The outbreak of measles is spreading across the United States. The outbreak started late last month in West Texas. The CDC reports there are now 164 confirmed cases in the U.S. One child has died. 34 people have been hospitalized. Local disease prevention pros are paying attention to the outbreak. They're working on emergency plans in case it shows up here. Our Bill Folsom is looking into the risk and the reasons for advanced planning. Bill.
Yeah, Diane, this is a CDC map of states with confirmed measles cases. Texas has the worst outbreak. There's also New Mexico, and it is happening right here between two counties on the border. That's not far from the I-25 corridor that goes right up to Colorado. A lot of people from Texas and New Mexico use that route. Well, a route for people and a path for them for people can also be a pathway for disease. Measles cases mapped and tracked by communicable disease specialists.
We are the disease detectives.
So far, there are no cases in Colorado from the current outbreak.
Measles is probably the most contagious illness, or one of them.
Right now, we are in what's called an event monitoring status.
It is a very small world out there. It doesn't take long to get from Texas to Colorado or any other state or nation for that matter. So we do pay pretty close attention.
El Paso County Public Health has a team following the spread of measles. Another department is putting together an emergency action plan in case measles show up locally.
One single measles case would put us into a response activation to be able to deal with that case because it is so highly contagious and spreads quickly.
Quick action that includes good information going out to the community can mitigate the spread.
How can we stop it?
We want the community to be informed, and we want them to be able to make informed decisions about how to best take care of themselves, protect the community.
And information from the CDC shows that measles had been eliminated from the United States back in 2000. Because of declining vaccination rates, it's back. Diane?
Bill, thank you. We wanted to know whether the MMR vaccine that protects against measles, mumps, and rubella wanes over time, and if adults can get a booster shot if they want to increase their immunity. Well, according to the Centers for Disease Control, most people who are vaccinated as children will not need any additional measles vaccines. But on its website, the CDC says adults who were vaccinated in the 1960s may want to consider it. That's because some vaccines given during that time did not use what's known as live virus and may not be as effective long term. Those born before 1957 are presumed to be immune because they lived during a time when measles was in the general population. If you do not have a vaccination record or perhaps access to it, the CDC says there's no harm in getting another MMR dose. Of course, check with your doctor about any healthcare decisions.